Millions of people take NSAIDs daily, but only few know about the risks. In this video, we're going to be talking about NSAIDs, what they are, their uses, mechanism of action, and the risks that are associated with taking NSAIDs. So now let's dive in and see what NSAIDs are. NSAIDs, as the name implies, they are non-steroidal anti-inflammatory drugs that are widely used in medical practice. And these drugs are used widely in medical practice for management of pain, fevers, and some inflammatory problems in the body. So now let's look at the three main properties of NSAIDs. We have the first one, which is the analgesic characteristics of NSAIDs. That is to say that NSAIDs can be used to relieve pain. The second one is the anti-inflammatory feature. That is to say that NSAIDs can be used in cases of inflammation, just as you can see in arthritis and other types of inflammatory problems that go on in the body. Thirdly, NSAIDs have antipyretic effects. That's to say that they can be used in the management of fever. Having known the uses of NSAIDs, we are going to know how these NSAIDs work in the body. That is the mechanism of action of non-steroidal anti-inflammatory drugs. Remember, as nurses, it is important that you know the mechanism of action of every drug that you are going to administer. It's going to help us to know how to administer these drugs and monitor for the side effects and contraindications of these drugs, so we're not going to cause problems for our patients. Now let's go back to the mechanism of action of NSAIDs. NSAIDs work by breaking down an enzyme known as cyclooxygenase enzyme, or the COX enzyme, thereby reducing prostaglandins. Now the duty of these prostaglandins are as follows: to transmit the perception of pain. It also plays a role in inflammation and fever. Another function of prostaglandin that so many people don't know is the fact that it helps to protect the stomach lining. You see why we don't administer NSAIDs when the patient has peptic ulcer, because once these NSAIDs are administered, it will reduce the effect of prostaglandin on the gastric lining, thereby causing peptic ulcer. Now you know why you should not take any NSAIDs if you have peptic ulcer disease. In our next video, we're going to be discussing peptic ulcer, so stay tuned. You don't want to miss out on that. So hit that subscribe button and click on the notifications so that you are among the first set of people that will receive a notification when that video is uploaded. NSAIDs are widely used over-the-counter drugs, so it's good that we know their names, so that anytime we come across them, we know that, oh, this drug is an NSAID. We have drugs like Diclofenac, Ibuprofen, Aspirin, Naproxen, piroxicam, indomethacin, Celecoxib, and so on and so forth. Now that you've learned a lot about NSAIDs, it is good that you know the side effects of these medications. One of the major side effects here is gastric bleeding. Remember when we said that NSAIDs have a way of inhibiting prostaglandin, and this prostaglandin have a way of protecting the gastric lining. Now when the patient takes NSAIDs, it can corrode the stomach lining, leading to gastric ulcers. So you don't want to administer NSAIDs to a patient that has the risk of peptic ulcer, or to a patient that already has peptic ulcer. Another side effect you may see is renal impairment. There are so many evidences that excessive or prolonged use of NSAIDs can impair the kidney function. So it is best that to follow prescriptions when taking NSAIDs, so that you don't go and cause another trouble for yourself in the kidney. Also, misuse of NSAIDs can cause myocardial infarction, also known as heart attack. So anytime you're taking NSAIDs, make sure you follow the doctor's prescription so that you're not going to have any of these side effects. Another side effect of NSAIDs you want to note is the fact that it delays labor in pregnant women. I would like to let you know that prostaglandins play a role in uterine contractions. If prostaglandin levels are reduced, it could delay labor in pregnant women. And that is why some prostaglandin agonist drugs like the misoprostol and the others are used in the induction of labor and the management of postpartum hemorrhage. We are digressing into midwifery, but that is fine. Having known the side effects of NSAIDs, let's see the contraindications, the condition whereby we don't want to administer NSAIDs at all because it could harm this patient or cause severe allergic reaction to the patient. The first one on the list here is peptic ulcer disease. Yes, NSAIDs will go further to corrode the gastric lining and make this peptic ulcer worse for the patient. So if a patient is having peptic ulcer, NSAIDs are a no-go area for that patient. Also, if this patient is already having any form of renal impairment, you don't want to administer NSAIDs because it will prolong the issue further. You also want to withhold NSAIDs when the patient is pregnant. This is because it could delay the onset of labor or even cause prolonged labor for the patient. So you don't want this for your patient at all. So pregnant women should stay away from NSAIDs. Other conditions like asthma and hypertension are also contraindications for NSAIDs. So if a patient is hypertensive or asthmatic, you don't want to administer NSAIDs because it will complicate their conditions. So let's look at some safe tips for using NSAIDs. Despite the fact that NSAIDs are powerful in reducing pain, fever, and inflammation, it doesn't stop it from being harmful if not used properly. So let's look at some safety tips for people that are using NSAIDs. Number one, use the lowest effective dose for the shortest period. You don't want to take high doses of this drug and it has to be for a very short period. As long as the pain or inflammation has subsided a little bit, you may want to withdraw these NSAIDs so that you don't cause problem for yourself. You also want to take NSAIDs with food so that it's going to reduce the gastric irritation. Another safety tip I'm going to leave with you is that you should never combine NSAIDs, because combining NSAIDs equals combining the side effects. It means that you're going to have more side effects than a person that's taking only one type of NSAIDs. So these are the safety tips I'm going to be leaving with you for now. So if you want to learn more about peptic ulcer disease, hit that subscribe button and click on the notification bell so that you'll be among the first set of people that will receive a notification when there's a new upload. And until then, keep learning, keep caring.